Hi there. This video is to look specifically at our template for reviewing HbA1c. If that's something you do a lot, it may be worth putting that on your toolbar, or you can access it through the Pathology overview. Now, like all of our pathology templates, we've got the same kind of review options. There are a few more that are specific to diabetes, to say it's been reviewed or changed, or treatment's been changed or declined, and so on. And then for appointment needed, again, it's a little different. So we've got diabetic nurse or clinician, whoever that might be in your practice, or GP or pharmacist. There are far more other options here, so just want to talk you through those. The information on the left is sort of similar to other pages and shows sort of what the outcome is, recent HbA1cs, kind of information that might be useful, particularly when reviewing prescribing, seeing when they were both first diagnosed and then the most recent code, what they've got on repeat, and so on. On the right-hand side, we've got options like your diabetes review template. What that launches will depend a bit on your setup, but for most of you, that will probably launch the Arden's diabetes template. We've got the option to graph HbA1c, review frailty, or diabetic formulary. This next bit is about a HbA1c target. So over on the left, we can see what the target is currently set to. The default is to set to the kind of QOF target, although there are a few localization options for your practice. If you are using HbA1c targets, then you can record a more specific target for that patient. So it might be that I say, actually, we're going to aim for 55. As long as that target's in the last 2 years, what our system will do is it will compare future results against that target and use that to decide whether they are well controlled or not. Equally, it may be that you can see on the left-hand side they have got a personalized target, but you want to ignore that, but without putting in a new one specifically. And this button here will clear previous thresholds. We've got a drop-down for SGLT2s because that's something we flag up to consider, and there's options to record that it's not indicated or not suitable. The option for the FP92A form. So those are all things you might find useful. You don't have to use them. The options up here will be fine, but these things can be helpful. Slightly separate section related to diagnoses, as well as the option to record a diagnosis. There's the option to say that the diagnosis is excluded. That's particularly useful if you are reviewing possible diagnoses and you think, actually, no, for whatever reason, you need to remove from that report and it's not appropriate to code at this time. We've also got options to record if the patient is under the DSN or under hospital. And again, recording these things after the latest result will clear away the kind of work to be done. The idea with this is that you can use it both in an appointment with a patient, or it might be something that you use when you're reviewing patient records. The way the system's configured, it will look at other sort of diabetes review codes as well, so you don't have to use this, but we hope it's a useful tool for you. Thanks.